For palpation, there's 3 areas where we're going to look at palpating for the anterior lower leg. If we're concerned about anterior compartment syndrome, we're going to be palpating the anterior compartment. So if you find the tibia bone, the sharp, rigid bone on the anterior lower leg, and you go just lateral to it, you're going to be on the anterior compartment. So the anterior compartment is located between the tibia medially and the lateral compartment laterally. With compartment syndrome, it's going to be very tender for the athlete as you palpate over, and perhaps excruciating, and it's going to feel like an overstuffed sausage. It's going to be quite a bit firmer on the injured side compared to the non-injured side. We'll palpate the tibia bone itself, and again with tibial stress fracture, there'll be one particular area where they have quite a bit of pain. With medial tibial stress syndrome or shin splints, there's going to be an area at the posterior medial tibia where they have most of their discomfort, where the tendons are pulling on the periosteum of the bone and irritating the periosteum, or periostitis. And then lastly, our dorsal pedal pulse, your anterior tibial artery that's in the anterior compartment, when it gets to the dorsum of the foot, a branch of the anterior tibial artery is the dorsalis pedis artery, so it supplies the dorsum of the foot. And with anterior compartment syndrome, the anterior tibial artery can be compressed, so the pulse, the dorsalis pedis pulse, won't be as strong. So it's located, it's between the extensor hallucis longus tendon and the extensor digitorum longus tendon on the dorsum of the foot. And you're going to use your fingertips to palpate for the pulse, not your thumb. Sometimes it's going to be a little bit tricky to find, so you can move fingers around until you locate it. If you're having trouble, there's going to be other signs that blood supply to the foot is diminished. Their foot is going to be paler or blue on the injured side. It's going to feel cold to the touch compared to the other foot. You can pinch the nail bed if nails aren't painted, and normally it should blanch white and then turn back to pink right away. Also, if having difficulty locating the dorsalis pedis pulse, another artery that supplies the foot is a branch from the posterior tibial artery in the deep posterior compartment, and it hooks right in behind the medial malleolus. So if you go with your fingertips right behind the medial malleolus, you may be able to locate that pulse. So I'll grab the camera and I'll just show you on the dorsum of the foot where those structures are located. So here's the dorsum of the foot. In black, we've got the extensor hallucis longus tendon here, and then in red we've got our 4 strips of extensor digitorum longus tendon. So the dorsal pedal pulse is going to be somewhere between those 2 tendons, and we've got the navicular bone here sticking out medially. It should be in line with the navicular bone, so right about there is where you're going to be checking for the pulse.